Welcome back. You can call us on 0808-054-2233. That's 0808-054-2233 if you want to ask questions about bad breath. You can also tweet at CTV_Mary A. We're back in the dentist's office. Okay, and so you've checked this person, you've treated him for whatever the thing is, and he's still having bad breath.
Yes. Question is, who is perceiving the bad breath? Sometimes we would have treated and the patient is okay, but in his mind he still feels that he has this smell.
Does this happen often?
It does. Many of the patients feel because they've had it, people have, they try to move back or close their mouth, cover their noses and all that, they feel they do. So sometimes we need to actually sit down with the patient and do some counseling and then do some talking to find out the psychological state of the patient. The patient is going through some maybe anxiety. Maybe he's afraid that anytime he talks to people are still closing their noses. They want to find out.
Okay, that's why 60% of them go through this anxiety.
Yes.
They're thinking of but if a person has been treated and the friends say you're okay, there's no problem with you anymore.
Yes.
Now your breath is fresh.
Yeah.
Why should they be having that problem? Or people are not moving back anymore, whatever it is. Why should they be having that problem in their mind?
Yes. There are a lot of psychological problems that manifest as psychosomatic halitosis.
Okay.
So if we do not get to the bottom of that problem, the patient will keep feeling that problem or manifesting.
And he will just be depressed.
Patient will be depressed. So that shows the role of the psychologist in the treatment of halitosis. We do bring them into the dental clinic and tell them to have an interactive session with our patients. We give them some drugs, and sometimes, a lot of times, many of them are free if it's a psychological problem. But for those that is true halitosis, once we do the treatment and give them all these measures, they correct their lifestyle, and then the patients are free and they're fine.
Okay, so if it's something you suspect that it's something within the body, maybe systematic, are you able to tell the patient what is causing it, or you refer him to somebody?
Oh, yes. Usually it could be ENT. Maybe he has postnasal drip or sinusitis or something that is causing it because of the mucus coming to the mouth. We refer to ENT. We can refer to endo. That's people that treat diabetic patients. We work together. We cannot take care of, only the oral physician cannot take care of just the halitosis. If you discover there's any other systemic conditions, then we have to take care of it. Maybe it's dryness or what. Even some people fast. During fasting, because they're not eating and they're
lack of food can cause it?
Yes, lack of food will cause that because of the dryness
in the mouth
associated.
Okay, we're getting a call now. Hello, Collins. Are you there, Collins?
Hello, madam. Good morning.
Good morning, Collins. What's your question?
Madam.
What's your question, Collins?
My question is this, ma. What if you are speaking with somebody, ma? Speak is coming out from your mouth.
We didn't get that.
Yeah. So, which medicine can someone take, ma?
Medicine. Okay. Thank you very much, Collins. Here's where you have to really lay down the law. He's asking what medicine can one take for this.
Okay, there's no medicine per se in treatment of halitosis. The treatment will be to wash your mouth twice a day.
Okay, I think he was saying when someone is having excess saliva.
Okay.
Coming out of the mouth.
All right. If it's excess saliva, there are drugs that we can use to reduce that. Oh yes, there are drugs we can use to reduce that. But we have to know what is causing the excess saliva.
I don't think these are over-the-counter drugs, are they?
No. So that's some drugs, like some patients that have worm infestation, that will irritate the GIT and cause excess saliva. Okay. There could be paralysis or some form of the face, and it's not allowing the patients to clear the saliva and all that. So we need to know what is causing the excessive saliva
before you prescribe anything.
Drugs. Well, they're not something that you go and pick up on the counter that you want to buy drugs to take care of excessive saliva. No.
Okay. So at the end of the day, can all bad breath be treated?
Oh yes.
Or prevented?
All bad breath can be prevented and can be treated. But what is important is after treatment for the patients to accept that the condition is gone. Some patients do not accept. Then we now need to further investigate to know what's causing the lingering. So people have bad breath for over 20 years. And they keep going from one clinic to the other, and they do the same thing. Same things we do, skin and polishing, take a lot of water, use mouthwash and all that, because of the psychological component. So that needs to be treated, and the patient will be finally free.
Okay, now I know that something like onions, for example, might cause a bit of uncomfortable breath. But there are certain things that people have to eat. What do you do with onions? Brushing doesn't take that thing out.
No. For onions, once it is cooked, most of the chemicals is within the water. Maybe you're cooking meat with onions. Most of the chemicals is within. But the problem is more of eating raw onions. When you eat raw onions, all the chemicals go into the body.
Okay.
And that is given off. The chemical is given off in the breath. The same thing with garlic. So we tell them, if you like garlic or you like onions, just reduce the amount of garlic and onions you're taking.
We're getting a call now. Hello, Ambrose. Hello, Ambrose. Ambrose is not there. All right.
Hello, how are you?
Okay, I'm doing very well, Ambrose. Good afternoon. What's your question?
Hello, can you hear me?
Yes, I can. Go on with your question.
Okay.
Yeah.
Please, I have a question, please. Sorry, I want to ask a question not really pertaining to tweet, but also here. My wife is in the Sokoto state. They transfer her to Sokoto for NYC, and he developed ear problem there, and nothing coming out from the ear. Anytime the doctors, they say the doctor they're having there is a doctor that all these widget called doctors. But anytime there is a sun, he keeps heat. There's always heat coming out from the ear, and heat pains, so many pains. But anytime they take it, they won't see anything. There is no blood. There is no nothing. So I don't know whether those doctors doesn't know their job or anything. But he feels heat anytime, any moment there is a sun. He feels heat and pains.
Thank you, Ambrose.
On the left ear.
Thank you, Ambrose. We've got your question.
There is nothing wrong. So
my guest is a dentist, not an ENT specialist. But do you have any advice for this person? I think they should go see an ENT specialist.
That's what I think. You visit the specialist or seek for second opinion with a specialist. I think that is what you should do. If the complaint is still there, the patient is not imagining it. Obviously, they've not been able to get to the bottom of the problem. So I
you have
think
to go ahead and
an ENT surgeon to take care of the problem.
All right, now, are there any types of food that one can eat for fresh breath that actually help the breath? People talk about cinnamon, you know.
Well, a lot of fruits. Fruits is good. Can take a lot of fruits. Anything that has a lot of liquid components will help to moisturize the mouth. Apart from the chewing gum we have spoken about, the sugarless chewing gum. Aside that, if you wash your mouth properly and you take a lot of water, I think you should be fine.
Okay, a final question. Nobody ever talks about brushing the roof of the mouth up there and the sides. Is that supposed to be done?
No.
Okay. That makes us feel better. Thank you for coming, Doctor. It's been a wonderful time.
Thank
you so much for being with us, and thanks for your calls. We appreciate them. You have a nice day. I am Mary Alale Yusuf.